Morning, it's Tuesday, 7:40 is the time. Jeff Andreas with you here on NL Mornings. Now, the federal minister for addictions and mental health says it is too early to draw conclusions about drug decriminalization. This comes after BC had asked Ottawa to scale back its pilot to help curb concerns about public drug use. On Friday, Premier David Eby asking Health Canada to amend the exemption order to recriminalize the use of those drugs in public spaces like hospitals and restaurants. While adults would still be allowed to use drugs in private, they could be arrested for using them in public. Now, the request followed months of backlash from residents, healthcare workers, police, local politicians here about the project's effect on public safety. And yesterday, the NDP, well, it used its majority here in the province to block debate and a vote on a BC United motion for the full repeal of David Eby's decriminalization. And let's get into this whole discussion, conversation, situation. Joined on the line by BC United Party Shadow Minister for Mental Health, Addiction, Recovery. It is Elenore Sturko. Shadow Minister, good morning. How are you here today?
Good morning. I'm doing pretty good.
Well, appreciate the time and thanks for joining me on this. It's a subject that we've been talking about for, well, the better part of a year and a half at this stage of the game. Maybe I'll just start with the reaction that you had yesterday to, once again, the second time that debate has been blocked on this. Now, it doesn't matter really to me what side you are, if you're pro-decriminalization, if you're against it. The fact that we're not having debate on the issue is somewhat concerning to me because I'd still like to hear all sides of the story, no matter which side I feel like I'm actually, supporting.
Well, exactly. And I think you hit the nail on the head. Why not allow David Eby's ministers to stand up and explain why they continue to support this project, this experiment, when it's clear that it has not resulted in a reduction in overdose deaths, in overdoses, and we've seen plenty of evidence that it's actually caused harm in communities across BC, felt acutely in hospitals. So, it would be great to be able to hear from, speakers on all sides, members of the Legislative Assembly. And, if they are committed and they're willing to double down on this failed experiment, then why not stand up and defend their position?
Yeah, I think that's a fair statement here at the end of the day is just, to get into at least the conversation and let that play out in a public forum. And that's kind of what your argument here is on this morning. I guess, do you still feel, maybe at least a little bit of a win at this point? You probably wouldn't consider it quite in that type of a venue here. But, do you look at least some progress with what was asked of Ottawa last week by the Premier, by the NDP to at least say, okay, look, hospitals, things like this, you can't be doing drugs in these settings. I mean, at least that's a step in the right direction, even if you would still rather see everything be repealed.
Yeah, I'm happy for nurses in particular and families who have felt, that their safety was at risk as a result of, a sort of a drug free-for-all, if you will, in certain places. Knowing that nurses we were told, some of them leaving every shift crying, feeling that unsafe at work. So, yes, I'm happy for that. However, the announcement by David Eby on Friday did nothing more than confirm the failure, not only the failure of the last 15 months, the failure to plan for his pilot, but also failure to provide services to people who use drugs and those with untreated mental illness over the last 7 years. So, we would like to see this repealed and go back to being able to enforce Canada's drug laws. Not that we want to see people put necessarily in prisons or, flood our courts, but there are mechanisms for alternative measures that would provide some avenues to compel people into life-saving services. And right now that doesn't exist. We're relying solely on a voluntary, situation here, and we're seeing that it's not being effective at addressing the root cause. And so all the stuff that David Eby and the feds announced Friday puts this problem back into the laps of police officers without providing additional tools to help get people into life-saving programs, and really is doing nothing to address the root of the problem. So it's nothing more than window dressing, and in my opinion, an attempt to save face politically, but really isn't doing anything to actually help people who are suffering from addiction in British Columbia right now.
Well, I'll get into some of the points you just made in a second, but I did want to ask, as much as it's nice to say, okay, things are illegal to be using drugs in hospitals, in restaurants, in parks, that's great to say. How the heck are we going to actually enforce that, though? I mean, that's what it always comes down to. You can tell people something is wrong, but if you can't actually, enforce the rule, then, how useful is that rule in the end of the day?
Well, you've hit the nail on the head. The enforcement is the key. And, when we talk about things, and people have probably heard this, talking about a 4-pillared approach, harm reduction being one of those pillars, enforcement, education, prevention. But they're doing a very poor job of managing the enforcement. And this is something that actually, this government time and again will go up in the legislature or on the media and talk about how they had the support of police going forward in the first place 15 months ago. But the reality is, and what we heard from Deputy Chief Fiona Wilson, is that police actually had warned the NDP that the way that they were going to be rolling this out would lead to unintended consequences and unsafe situations that would prevent them from doing their job properly. And so what we've seen is this sort of unwinding and normalization of illicit drug use in places where, it is very reasonable to expect people would not do that. Example, hospitals. So it's going to be very difficult. And unfortunately, this is going to thrust this issue on police. I mean, I was thinking to myself, look, after Friday's announcement, how many calls were they getting? How many calls were police getting to move people on? And if people don't understand what this means, what BC, what David Eby is asking Ottawa to allow is that it is illegal, but that they don't detain people who are using drugs, they don't arrest them, that they don't compel them to court for charges. They want them instead just to be moved along and tell that person to move away from the area. But there's nowhere to move people along to. And this is something that we actually talked about extensively when we debated their Bill 34, their great solution to the issues of people using drugs in parks and playgrounds and splash pads. The reality is that you cannot move people along and then have no services to move them along to and then expect it to be successful. It does a disservice to everyone in the community, especially those who have addictions, and it won't actually address the root of the problem. And this is what is, really, really sad about it, is that last year we had the deadliest year for overdoses in British Columbia's history. Untold amounts of suffering, not only, people that lost their loved ones. The ripple effect in our communities is immense. And to not address the root cause and to not find other mechanisms to actually help guide people towards services is a failure.
Now, I want to go back to one thing, because you had mentioned, the idea of basically not like forced recovery. I don't think that's really how you were phrasing it. But, how do we get people into these services? Because that's, I know, one of the major talking points, one of the major issues that we've had throughout this whole thing is, it's difficult to find availability in, counseling or something along those lines, to find someone who's actually available to speak to a person. We know how long wait lists are for getting into recovery facilities, to getting to complex care beds. I mean, this is the biggest issue to me, is the lack of availability to get people to treatment. Now, you talked about, okay, we can't just force them into treatment, but I always believe you have to at least force someone to have a conversation. If you get picked up for drug use 6 times in a park, you can't just say, okay, well, be on your merry way, and then hopefully we don't see you again in the next little bit. We should at least put them in front of someone to say, hey, this is an issue. You clearly have a problem. Let's talk about the options that are available to you, and at least let them know that the services are there. That's the one thing I always feel is missing. I'm not saying force people into treatment, but force them to have a conversation.
Well, you're saying exactly what I'm saying, is that we need to have multiple avenues. Look, we've introduced, for example, this year, private member's bill called the Safe Care Act of BC, which addresses dangerous situations for youth, for example, where there's exploitation or, an imminent threat to that person's life. And so we do think that there is a need for some avenues for involuntary care for those whose lives are at risk. But that wouldn't mean anything to do with criminality, right? So that's one avenue, going through certain acts for medical purposes. And of course, we need to scale up voluntary services for those who are ready to reach out and get help. And for people who have entanglements with the criminal justice system, for example, if they receive multiple infractions for failing to, abstain from using drugs in certain areas, why not expand programs like the Vancouver Drug Treatment Court that already exists? It doesn't mean you're immediately forcing a person to go into treatment against their will, but there are other programs, there are other services that those people can be connected with. And, we can make it alternative justice measures. Canada has a long history of providing measures of alternative justice, and there's ways that we can make this work while being fair to individuals, not ensuring that they have long criminal records, and putting them on a pathway that actually gets them into services where they can be connected with healthcare, where they can be connected with counselors, where we can get them into housing and social supports. But, unfortunately, with the way that this illness works is that not everyone will be able to make that voluntary decision. And it's very sad. And, we need to do more to really get to the root of this problem. And then the other big pillar that is missing here in British Columbia under David Eby, and certainly they did nothing to address this Friday, is prevention. We need to cut the head of the snake off. Why are people getting addicted? Why are they starting to use drugs? We hear all the time people 7 a day dying, primarily overdosing from fentanyl. But how much research are we doing to find out how did those 7 people start using drugs? What started them on their pathway? Let's get more information about that, and let's start addressing those areas as well so that we can protect the next generation from succumbing to this terrible fate.
Last question here for you, Elenore. But I just want to ask, because this has been talked about or said, this phrase quite a bit, and that's the failed decriminalization experiment. We're 15 months in, to the day right now, since the policy was enacted. It's a pretty dramatic shift in the way that we're viewing, drug use in our province. How much time should something be given before deeming it a failure? Because 15 months doesn't feel very long. I know it's a 3-year pilot. I don't know if that's necessarily the time limit you got to wait for to really judge whether something is working effectively or not. I know it hasn't really worked to this point. I understand that. But I do think, maybe we're not giving it enough time by saying it's failed here right now. It maybe hasn't worked to date, but that doesn't mean it still can't work. That's how I view it. And I'm just curious to give your thoughts on how long do we have to have a dramatic shift in policy before we deem it really a failure, as the BC United Party has to this point?
Well, I think it's a failure. So I do disagree that we need to continue going on. And I heard Yara Sachs yesterday and saying that, we haven't had enough time to review the data. Look, we were promised a robust study and a monthly dashboard where they would be looking and analyzing monthly at data. But they failed to do that. They quickly realized that they were, well in over their head, that it was completely unreasonable for them to be able to monitor this the way that it actually should be monitored. They changed it to a quarterly dashboard, which, by the way, actually shows, for example, opioid agonist therapy, less people are accessing that care since decriminalization. Less people are staying in with that form of treatment since decriminalization. So how long do you let it go? I think that the fact that they have information now that shows that it didn't reduce deaths. We've seen other jurisdictions who've tried the same thing also have very poor results, terrible results, in fact, in Oregon. So why not pivot? This costs $80 million. Decriminalization is costing $80 million. How many other services could we put towards helping address the root cause of this problem, towards prevention, towards housing individuals who need social supports for $80 million? Many. And I think that, the fact that they actually didn't even bother monitoring for negative outcomes, didn't bother, doing any kind of survey to see what municipalities were experiencing in terms of negative unintended consequences until September of 2023, when cities started asking to implement their own bylaws, really shows you that these people are not managing this program. It is not helping anyone, and it's time to shift our direction and use the taxpayer dollars that are going into this for things that we believe and we've already seen have the ability to impact this crisis.
I appreciate the conversation. I appreciate the time, and this is why I wanted to have you on, because these are the statements I wanted to hear in the legislature yesterday, but unfortunately weren't able to have that debate. Again, like I said off the top, I don't care what side of the floor you're on. I think that conversation needs to be had, and it was a little bit disappointing to see that not happen earlier this week. I appreciate the time, Elenore. Thank you so much for joining me, and I'm sure we'll talk again down the road here.
You got it. Anytime.
Absolutely. That's Elenore Sturko joining me here. She is the BC United Party's Shadow Minister for Mental Health, Addiction, Recovery,